Welcome to the Big Story segment of the BDTV Breakfast Show, where we discuss key issues shaping our nation and economy at large. I am David Olujimi. Today, our discussion revolves around the healthcare sector as we focus on solutions to tackle the rising cases of meningitis outbreak in the country. The Nigerian Center for Disease Control and Prevention (NCDC) confirmed that Nigeria is presently battling a meningitis outbreak that has led to 151 deaths and over 1,000 suspected cases, about 1,826 cases. And this meningitis has a case fatality rate of 8.3%. Meningitis is an inflammation of the membrane surrounding the brain and spinal cord, which is known as the meninges, often caused by infections, and it can be a medical emergency requiring immediate attention. According to reports, this disease is now present in 23 of Nigeria's 36 states, in what is a scary picture of possibility of more deaths if urgent measures are not taken to curb it. Our discussion today will provide answers on the urgent measures that should be taken, expectations from the government and private sector, where the families of affected persons can also seek medical services. To address this and more, we are joined by Chika Ofor, a public health expert and advocate, and the founder and CEO of Vaccine Network for Disease Control. You're welcome to the show, Chika.
Oh, thank you very much. It's an honor to be here.
Yeah, great.
To talk about Nigeria and the health indicators.
Okay, so for the sake of our audience, can you just help us understand what meningitis is about?
So you just explained it. It's an inflammation of the membranes that surround the brain and the spine, And then, in those days, they used to call it tom neck,
Okay.
And the thing I want to say is about meningitis that is very important today is that it's vaccine preventable.
Okay.
So when we talk about vaccines, and when people die from vaccine preventable disease, it breaks my heart. So for me, when you have all these symptoms, maybe fever, headaches, nausea, all those, you can't eat, that kind of thing, go to your health center if you are in the community to go and make sure that you are fine. It's very, very important. So what I'm saying here now is that if you have your children, once your child goes through the routine vaccination program, that child would have taken meningitis vaccine. Because at 6 months, 6 weeks, 10 weeks, and 14 weeks, the children are given the conjugate meningococcal vaccine, MCV.
Okay.
So once you are able to do that, it helps. And then once there's an outbreak, then the government again provides that again, so that for those outbreaks, they also give vaccine and then do case management, check houses, make sure that people who have those symptoms are taken to the health center or any health facility.
So you're saying that meningitis is a communicable disease. Is it spread from person to person?
Yeah. It is. It's communicable. That is why we're having it as an epidemic. If it was not communicable, it will not be an epidemic. It is through liquids, that kind of thing. We are living in a place that, unfortunately, because of poverty and all that, people live in tight spaces, in communities. And in those kind of tight spaces, you find that it is easy to transmit one disease or the other, So, and it's very important that we take note of this. So that when you see, and then nowadays that, this is the dry season.
Okay.
And because you notice that these epidemics or these outbreaks always happen in the dry season. That is why you find that places where where the heat is a lot. And then people stay in closed spaces and, and then the person has not taken vaccine on top of it and there's poverty. One of the major causes of most of these diseases is poverty. Because it is poverty that is making someone not to, maybe because of access, does not go and take vaccine when they're supposed to take the vaccine. That kind of thing. It is poverty that is making somebody have to say, should I use transport to go and take vaccine or should I buy bread to eat? It's poverty that makes you not to be healthy enough. You're not eating well enough so that when these outbreaks come, you don't have enough defenses to fight.
So the thing here is that the reason why this particular topic has I I think I have my own experience because I remember
Yes.
when I was in secondary school, we had a meningitis outbreak in the state where I lived in secondary school. I
Yes.
schooled in the Middle
Yes.
Belt, and all the school students from the ages of 13 were given the meningitis vaccine free of charge across all the schools in that particular state. But it seems like now we say 23 out of the 36 states. It seems like this thing affects people majorly in the north. Is it, or is it, like you spoke about the dry season? Is it a disease that has some weather, some climatic conditions to it, that has like some alignment to climatic conditions, or it's just a regular spread communicable disease by liquids and all? Does it have anything to do with
Okay,
climatic conditions?
it has to do with climatic conditions because of the fact that the dry
Okay.
season comes with heat,
Yes.
and then when it comes with heat, people live in very tight spaces. And when those tight spaces and somebody already has the disease, it's easy for it to spread.
Okay.
So that is the reason why. And because it is highly contagious, it is easy to spread in those kind of communities.
Okay.
Like where I am now in Abuja, we have some of those illegal communities. When I call them illegal, what will I call them now? Informal communities. Yeah, people live in one room like that, and it's easy for people to direct contact, because you get it through direct contact, you get it through droplets, you get it through contaminated surfaces. People share toilets, people share bathrooms, people come together, easy for people to come. And then the heat. Do you not notice that this dry season was something else this time around? So the heat is terrible.
So basically, the classes of people that are more at risk of contracting the disease are people that are that live in enclosed spaces.
Yes. So, and most importantly, people who have not taken the vaccine. Let's not forget the most important part.
So,
and the reason why it's mostly in the north is that when we look at our indicators for demand generation for vaccines, these are the places where we have, like now we're looking at the 100 LGAs that have 0 dose. That is children that have not even taken one single dose of vaccine. Many of them are in the north. So Lagos has 1 dose community, which is Ilaje. That's the only place in Lagos that you can call a 0 dose. That is babies, children that have not even taken 1 dose of any vaccine.
Meningitis vaccine.
Meningitis is part of the routine. So that means that once you go to a health center and the child is 6 weeks, the child will take. And it's free.
But why do you think, at least I just told you about my experience. I know that some of these vaccines are free, but what is happening? Why is it a problem for people to get these vaccines? Why is it lack of knowledge, or what are the factors responsible for people not getting these vaccines?
The truth of the matter is there are many factors that make people not to take vaccines.
Okay.
One, people might be knowledgeable about it and still not want to take it. Some, they may not be knowledgeable about it. Some, it is access, Some, there are various reasons why people don't want to take vaccines. Some, it's just having to go to the health center multiple times, Some, their culture does not allow them,
okay.
There's one of our communities, they said they don't take injection. That kind of thing. So there are many reasons why people don't take vaccines. But what are we saying is continuous education is the way that we don't give up. All hands must be on deck. The government, NGOs, private sectors must come together to make sure that we continually educate people on the value of vaccine. And vaccine is one thing that is actually based on trust. Yes. The people that should talk about vaccine are people that are trusted within the community, like the health workers that are trusted and the traditional rulers that are trusted, using trusted community members and being very innovative on how to create demand for vaccine or immunization, So, and that is majorly one of the reasons, because right now for the routine immunization programming, we have 53%, our vaccine coverage is 53% generally. What it means is that all the people that are eligible to take the routine vaccination, only 53% of them have taken. So you still have about 47%, I think, yes, that have not taken. So those people that have not taken, now let's not taking your vaccine with poverty. They're not eating good food. Poverty comes with a lot of, these social determinants as well. Then they are still going to go to primary school that is crowded. They live in a crowded location. So any disease that comes, it's easy to just capture them. And what is painful in this case is that it's a vaccine preventable disease and the government has provided the vaccine.
Okay. So at this point, what is the government doing, or what should the government be doing? And also, what is the role of private sectors, especially with regards to, now we know that there's an outbreak of the disease. NCDC has told us that
Yes.
about 151 people have died. That is quite a figure in
Yes.
casualty. What do you think the
Yes,
government
it
should be
is.
doing right now? What is at stake that the government should be
The,
looking into right now?
the good part of it for us is that we have a proactive government when it comes to the health. At least a proactive government in the sense that the Minister of Health is an advocate. So he has a project called the MAMI project, which is to crash maternal, child, and neonatal deaths. So with that in mind, they also have the NCDC as well that is there to make sure that vaccines get to all those that need them. So the first thing is that creating awareness. They have emergency measures, outbreak measures that are available in those states where you have these outbreaks. They are going house to house and also vaccinating all those, testing, checking, making sure that all those who have the disease are treated and all those who don't have are vaccinated. So, but then again, I also realize that whether we like it or not, the government cannot do it alone.
Okay.
There's a role for CSOs. Many CSOs, there's a role for CSOs, there's a role for private partners, there's a role for for the community themselves, there's a role for everybody, even you that you're talking to me today, there's a role for you. And you're doing your role by talking about it so that people get to know about what is happening in the country. So the first one is they've already dispatched, they have dispatched teams to make sure that in those particular areas where you have this very strong outbreaks, they're there to make sure that they test for people who have, and then to also make sure that for people who have, they are directed to treatment, and for people who do not have, are given the vaccine. And then CSOs are supposed to be there to support, to create more awareness. Private sector is supposed to use what they have to create awareness. The media is also supposed to use what they have to create awareness, to start to talk about which facilities, give directions to facilities that people can go to. So that once you, and then talk about the symptoms, all those things, once you have these symptoms, go to the health facility. And then to make sure that things like the insurance system, the insurance schemes, the NHI here has said that insurance is compulsory for all Nigerians. So that these things, people are not afraid to go to facilities because they think that they're going to pay. So all those things should be working. If everything works, you will see that many of these diseases, when they come, especially the preventable one, it will be easy for these diseases to be curbed.
So
vaccines, miracles.
So I want to talk about the drugs, meningitis drugs. Do we have drugs to cure meningitis, or it's just a case of just vaccines? Do we have drugs
The
in the
vaccines
market?
are there. Of course, there are treatments.
Okay.
There are treatments for it as well. So treatment for those who already have the disease after testing, and then vaccines for those who don't
have it. Yes.
So that is what we should be talking about right now. We should be giving information as to what are the symptoms that you have that will make you. Doesn't mean that when you have all those symptoms, you have meningitis. No. But you cannot know if you do not go to a health facility. All these treatments, self-medication, this is not the time for it.
Okay.
This is not the time for it. This is the time for you to go to hospital and check how you are doing, so that on-time treatment can save many lives.
Okay,
so it's very, very important.
So
it's an outbreak. It's serious.
So for a state like Lagos, I know that presently the 23 states are mostly domiciled in the northern parts of the country. I'm even guessing all 19
states.
I think all 19 states of the north probably already have the outbreak. But is
Oh,
there what
wow.
is the based on your own assessment and understanding of this disease, what is the risk factor for a place like Lagos State? Is it very high? Lagos has this kind of Lagos has a kind of Lagos is characterized with a kind of situation where diseases outbreak in Lagos can be quite rapid. If there is an outbreak, it can rapidly spread. What is the risk factor for a place like Lagos State?
But the risk factor is very high. Lagos
Okay,
is a very large state with many people, people entering buses, people
living in enclosed
jumping,
spaces.
government living in closed spaces, people living in Ilaje and different places. Of course, it's very high. But then
Oh,
again, Lagos has insurance. And then many of the primary healthcare centers in Lagos are also working.
okay.
So the thing is to now sensitize. I'm focusing more on the sensitization because that's what is key. So sensitize people so that when they have those symptoms or symptoms that look like that, just go to the health center and make sure that you are tested and checked. So that once you don't have it and you have not taken the vaccine, you can take the vaccine if it is available in Lagos. Because right now, for children between the ages of 6 weeks and 9 months, you have vaccines for them.
Okay.
So you have at 6 weeks, 10 weeks, 14 weeks, and then 9 months. The vaccines are available in primary healthcare. There's no shortage, which is why we keep focusing and talking about vaccine financing, talking about domestic resource for vaccines. The government should not play with the fund to purchase vaccine because the first level is that those vaccines have to be available. Because
Okay.
once they are available, what you're talking about now is creating demand, creating awareness, so that people know that these vaccines are available and you can direct your children, your babies, to go and take these vaccines. So that is why we must continue to advocate that the government should not play with vaccine financing. It should not play with domestic resource for vaccines. It should not play with procurement of vaccines,
So,
as we can see.
how far you spoke about vaccine funding? So, I want to ask, how far gone are we in Nigeria's efforts for vaccine manufacturing? Like, do you have any idea how what's going on? The facilities, are they being built, or we are at a stage where we are still the people involved are still looking for money? I think there's been mention of so many talks to try and start vaccine manufacturing in Nigeria by different pharmaceutical companies. How far gone are we with respect to that move, that effort?
So, from a CSO point of view, because I'm a health advocate and I'm a CSO, I'm a civil society organization, the only thing I can say for sure is that the conversation is ongoing.
Okay, okay.
And I also know that Gavi has supported with some funds to support the vaccine manufacturing process. But as we speak, we are not manufacturing any vaccine as we speak. But the conversation is ongoing. That is what I know. So it is very important also when you bring out this conversation is that you and I should start to amplify this conversation because at the end of it all, it is important that Nigeria starts to manufacture their vaccines. We have nearly 8 million children that are born every year, about a little bit above 7 million children that are born every year. These children need vaccine, including this meningitis vaccine you're talking about. So right now, what is sure, the sure way of getting those vaccines is that Nigeria has to procure those vaccines. But Nigeria must continue the conversation around local vaccine manufacturing so that in the nearest future, we start to produce our vaccines.
Okay.
Not only for Nigeria, but for Africa and the
So,
world at large.
just to round up very quickly, I know that we want to talk about the role of government in vaccine manufacturing and all, but I feel like there's a market, there's commercial viability, there's a market for there's a vaccine market. Basically, we have a system where children take measles vaccination. I think there's smallpox vaccine, meningitis vaccine, and in my own understanding, I think meningitis vaccine also exists for teenagers. So we have like this huge market with our rising population. What is the delay? What is hindering our pharmaceuticals from moving into that market? What do you think is the major delay behind them not being able to key into the market that they have on ground already?
I didn't say they're not keying into. I said that the conversation
is
It's
ongoing.
ongoing.
Yes, but the conversation has been ongoing for a
Can you
very
hear
long
me?
time now. I can hear you. I said the conversation has been ongoing for
Yes.
quite a while.
Okay.
No, I
So
was just
let me
saying.
explain something.
Okay.
Vaccines are very sensitive things.
Okay.
They are things you are giving to our babies. Nigeria has to make sure they get it right. You don't want a situation where there's one mistake and all the gains that we've had now from demanding for immunization will be lost. So I don't think there should be any hurry. My own personal opinion as to manufacturing vaccines. What we should do is to make sure that we get the experts, make sure that we have the infrastructure, and then make sure that everything that is needed to have a very robust, effective, efficient manufacturing system is done. Because vaccines are given to children from 0 to 5 years. It's not a joke. So the rush to manufacture vaccine is not the one that is important. It's to make sure that when we get into that system, we do it correctly.
Okay.
That is what for me is very, very important. What for me is also key that right now that we're talking, Nigeria should make sure that they fund their vaccine procurement. Right now, what we are doing is that we are procuring. So let us make sure that Nigeria now puts it in a first line chart because it's still in service-wide vote, struggling with other things. It should not be struggling with other things. It should be put in a predictive system where you can predict that this money has been budgeted for vaccine, and after that budget, that money actually has been budgeted, the total amount will be released to procure vaccines because that is the first level. Because after all said and done, if we create demand and there's shortage, what are we talking about?
Okay. Thank you very much. Thank you very much, Chika, for your insight, for this insightful conversation. And that's all we can take for today on Big Story. Keep watching Business Day Television.